So I hope you can hear me now. Welcome to yet another live session on speaking master skills or mastering speaking skills. So today we are going to look at how we can handle sensitive issues. And this is going to be a really interesting session. So on your chat box, please type where you're from. And I would be really excited to answer your questions and to help you improve your speaking skills. Right. So we're looking at how to handle sensitive matters as part of the clinical communication criteria of OET speaking. Right. So I'm looking for your feedback, and this is going to be really interesting. Excellent. So, well, there could be a slight delay while we get started, and that's all right. So, and I would be really excited. Perfect. All right. Let me know where you're joining from around the world, and it could be good morning, good afternoon, or good evening, wherever you are from the world. Yes, from Victor from Nigeria, Munir from Pakistan, Deepa from the UK, Mohammed from Iran, Fatima from the Kingdom of Saudi Arabia. Excellent. Aida from Philippines. Great to see all of you join. Yes. Hello, Alicia, Daigi, Aida, Angelo. Good to see all of you from the Philippines, from Iraq, from Morocco, from Ireland, from Des and Anna from the Philippines, from Chile, Javier from Chile, great. Mai from Egypt, from Sudan, from India, from everywhere, great. So here we go. Yannick from London, good evening, everyone. I'm sorry I cannot catch up with all your names, but I'll try to catch up with you once in a while. So the core area we are going to look into today is handling sensitive matters. Now, in the chat box, can you type in an answer to this question? Have your patients discussed sensitive matters with you? Now, this is very important in your professional life as well as in the OET's speaking test. Now, a lot of candidates find this aspect a little bit difficult because even at work, you're not used to handling sensitive issues, and worldwide, health professionals are often not well trained in handling sensitive matters, and that reflects at the workplace and in the OET speaking test as well. Yes, so you're telling, Raju is telling, Afra is telling, yes, people have discussed sensitive matters, and that's probably not a very comfortable time for you to be discussing sensitive issues with your patients. So a lot of you have gone through it, and has it been a good experience? Now, can you think of this? Think of an embarrassing or distressing condition or circumstances or events which you have had to face. A patient told you about a particular condition or a situation. They find it difficult to discuss with you, and you were also perhaps not too comfortable, or you've had some issues in handling that. Can you think of those situations? And can you type in, yes, you had to ask during history taking? Yes, Raju, that's right. sometimes during history taking, but sometimes much later into the discussion with the patient. Abdo says, of course, it's very important indeed, yes. Sexual history in terms of assessing HIV risk. Excellent, Raju. Yes, that's one area which we will be covering today. Yes, so it's very difficult to talk to a person about their sexual history or a lot of other embarrassing conditions. Yeah, the sexual orientation of a person, yeah, it's difficult, it's sensitive, and a lot of people do not know what to do when you have to deal with a sensitive issue. Others also can type in any event or a condition or a situation which you have had to face with a patient which is very, very embarrassing. Yes, gender fluidity, yes. Religious beliefs, yes, Yannick. Having STD, yes. And yes, that's right. Yeah. So it's good to know that you are aware of a lot of situations and you have gone through that. So that makes it easy for us to explore how you can do that better, improve on those areas, and yeah, excellent. Vasavi, yes, problems related to urinary tract. Perfect. So I've got a few examples on the screen. Now, this is not an exhaustive list. It doesn't cover everything, but just a few examples which could, come under the scanner for you in, handling sensitivity or embarrassing situations. So you have mental health issues like dementia, Alzheimer's, ADHD, schizophrenia, and bipolar disorder, lifestyle related like obesity and diabetes, sexual health, as we have discussed. Nihaya says chronic disease, yes. Duru says overweight. Imre says disclosing sensitive information, excellent. Excellent. Breaking bad news, Gayatri, very good. Absolutely, yes. Physical problems. Michael from Cuba, yes, or the UK, right? You have age-related issues like urinary incontinence, dependence or addictions, alcoholism, substance abuse, and all those things. Terminal illnesses like cancer, dermatological problems, hygiene, all those things, right? So let's move on. Now, this is very important. Your sensitivities may be different to those of the patient. As a healthcare professional, you would have experienced, seen, and discussed these issues over and over. So you are very comfortable with these sometimes. So it's part of your professional work, and you see it every day, day in, day out. So it's not a big deal for you. So you may not be too sensitive about some of those issues, but for a patient, perhaps they could be encountering it for the first time. And then so they are very much worried about how they're going to discuss these things, and how will they start the conversation. What would the doctor or the nurse or whoever is the health professional think about it? Isn't it going to be a lot of shameful experience and all those things? But you need to understand that and be empathetic about those things. Good to see Shahir from Bangladesh and Deveen from the UAE. Excellent. Forgive me if I pronounce your names wrong. I'm looking at a screen from a little bit distance. So, well, I'll try to keep it close to me. Right. So remember, now, when you're in the OET's speaking test, a lot of times candidates forget that you're supposed to be doing the role of a health professional. So if you're a doctor, you have to do what a doctor do at work, and if you're a nurse, you have to do what a nurse would do at work. So, but in a test condition, sometimes you get stressed and you forget that this is what you're supposed to do. So when you have that stress already, you're not going to think a lot about, okay, this is a sensitive topic and I have to show some sensitivity while I discuss that. So you have to deliberately and consciously look at issues that could be sensitive and learn how to handle that better. So once again, I repeat, your sensitivities may be different from those of the patient. Yes, so now from KSA, the Kingdom of Saudi Arabia, and Swadip from Bangladesh. Yeah, excuse me, I have a slight power outage, but still I can continue. Excellent. Yeah, the backup power is back. Sorry for that. Now I'm going to just give you a few warm-up activities just to be on track. We have discussed some of these, but quickly I want you to identify which of these is appropriate when you're talking to a patient. So you see a young boy and you have 4 options given from a health professional. Now, you have to tell me which is appropriate given the sensitivity of the matter. Hello, everyone from everywhere, from the UAE, from Philippines, from Bangladesh. You're welcome, Sana. From Balochistan, great to see all of you. Yes. I see options 3, 2, 3, 3, 3. Right. AB from UAE, yes, everyone. Yeah, most of you have selected option 3, which is the right one. So it's not okay to tell somebody that they are fat or chubby or obese. The more sensitive way of telling that is like, for instance, something like your son has an unhealthy weight, so you are taking the judgmental aspect away from the conversation, and you are looking at the problem rather than the person. And that happens with a number of conditions. Very good. So we've got a lot more to do, so let's go to the next one. Now, you just have 2 options. I wish it were otherwise, but it looks like the cancer has spread. Or your pathology reports show that the cancer has spread. Which one do you think is appropriate, 1 or option 2? Yeah, answers are coming in. Answers are coming in. Yes. So very good, very good, very good. It's this is interesting because you have a lot of options. You're coming up with both the options, but most of you go for I think it's equally balanced. Well, the better option is that I wish it were otherwise, but it looks like the cancer has spread. So instead of being too direct, this is something which is better for us to do. Like you are pacifying the patient, and rather than being too blunt, it's a little bit polished way of telling. Yeah. And we are going to a little bit more detailed analysis of some of the examples which I'd like to discuss with you. And we have some of our previous patients with us. Now we have Maya. If you remember, Maya was there in our previous sessions as well. Now, Maya was embarrassed when a colleague at the law firm told her that she had a bad breath. Now, that's really not a good thing for somebody to tell you that, you have a bad breath. However, she does not want halitosis to affect her high-profile job as a lawyer and has decided to see a doctor. So this is the situation, the background, and I've got a role play card for you based on this, and so we are going to discuss how you can handle specific points in the role play card, so that you're able to do it better and get great scores in your OET speaking, but also you know how to handle it better at the workplace, right? So right now I'm at the first bullet. Find out how the patient is feeling. You can type in your responses and I'd be happy to read some of them, though I may not get enough time to read every response. So I want you to type in how you would find out about the patient's feelings and thoughts about the condition. Raju says, ask her understanding of the cause of halitosis. Yes, that's a good option. Type in your responses. Oh yeah, how she felt when the comment was made. How can I help you, Afra? Very good. Okay, before proceeding further, do you mind if I ask you some general questions to get a better understanding of your condition? Excellent. Nonso says, you seem very low in yourself. Can you tell me what's going on? Yeah. So encouraging words are always welcome. Sorry again for the power fluctuation. Yeah. Ask the patient how she's doing today and how you can help. Luciel, yes. And Wasawi says, it must be difficult for you. Could you inform me? Ankit says, hi Maya, I know the feelings of bad breath, but don't worry don't worry, it can be easily cured. Yes, it might be upsetting. Yeah, can you tell me about what's bothering you, Pradeep? Yes. Annalise says, would you mind telling me all your concerns? Biji says, I'd like to talk about your condition as per your doctor. Biji, I don't understand that entirely, but I think it's all right. Yeah. So when you ask a patient how they are feeling, it is also to put them at ease. And especially when you have a sensitive issue to handle, the ice-breaking kind of introductions are really, really helpful. So it is absolutely all right to, say something which is general, which will make them really comfortable. How do you feel now, right? You look quite disturbed. Yes, nonce. And could you please tell me about your concern? A bear and Devin says, would you what to do with your condition? Or is it like, what could I do with your condition or something like that? Yes, that's right. So they need to express their thoughts, concerns, Kartika says it's to the GP. Or okay, yeah. Now this is a nurse in a general practice. It doesn't say that it's with the GP, but even nurses do consultations at the GP's clinic, so that's all right. So it doesn't mean that she's going to see a GP. She could be, she couldn't be, or as a nurse could be handling it as well. That's all right. So, yep. It's good to see that many of you, or most of you, have an idea about how to do this part. Let's move on to slightly difficult parts now. Now, empathize with the patient and explore their concerns. All right. So sometimes it could happen that you run out of steam, and I hope you're able to see me. Okay. So how do you give me some more sentences on how you can empathize with the patient in this situation? I hope you are able to listen to me, because on one of my feeds I'm not able to see you. Right. Yeah, I guess I'm back. Okay. Is she worried about something in particular? Do you have any problems? I understand how you feel about your condition, and I am here to listen to your concerns. Can you tell me more about them? Excellent. That's from Noemi Silverio. Very good. Now, what do you mean by empathizing? When you're empathizing, you are stepping into the other person's shoes. So it might not be entirely. Motas from the UK. Hello. Orchid says you don't have to worry. Let me tell you something. Sometimes we tend to overuse that expression, and I think I've mentioned that earlier also. When we say it's all right, you don't have to worry, that might not actually console or comfort patients entirely, because it might sometimes sound as a little bit hollow, not a genuine comment. When you just say like, it's all right, don't worry about it, they will still be worried. So you have to be a little bit more specific about why they don't have to worry. Yep, I understand that you're a bit uncomfortable about your condition. Can you tell me more about it? Very good. Pradeep says, I certainly understand your feeling. Don't worry, we are here to help you out. Understand your feeling about what? What particular understanding is that? And, you have to really go a little bit deeper, because identify those emotions or thoughts and link it back. So if you can go back to my previous recording on OET's recording library, you'll be able to see where I discuss that in a little bit more detail, right? Yeah. So when I tell you that empathizing is not just about I can understand your feeling or don't worry, what I mean is that you have to go deeper into the specific concerns that a patient shares with you, and then analyze each of those. Use language that is comforting and consoling, at the same time analyzing the actual situation as well. Right. Let's now move on to reassuring the patient that bad breath can be easily treated with improvements in hygiene or lifestyle. Now, this is a little bit, again, tricky because reassuring or persuading or empathizing are all a little bit difficult for many health professionals than explaining or telling them the giving them the factual information. I can appreciate your concern. I can see that this is very troubling for you, and we will do everything we can get to the bottom of it. All right. Very good, Nigel. I can understand your feelings. Don't worry, we can solve, Priya. Yes, but again, you know, not too much of don't worries. There's nothing wrong with it, but sometimes we tend to overdo it. That's the only problem, and it's not a major concern. So don't get me wrong there. Now, when you reassure, what do you expect? Then you can reassure with your emotional support as much as with clinical information. For instance, you can tell them, that there are a couple of tests, and so you'll be running those tests, and based on the test results, you've got treatment options, making sure that the bacteria don't come back, or all those things. That's fine, and they'll be happy to know that. At the same time, your support is equally important. So for them, it's not just about getting rid of the bacteria or whatever causes halitosis. It is more about their professional life. It is about their dignity. And so when you're reassuring, make sure you blend both, rather than just highlighting the clinical aspects of the diagnosis or the treatment. So that's one area which I want you to focus a little bit more on. Excellent. Yeah. So, and advising, yes, you can tell them you have to do these things, which is comparatively easier. So I've got a few more case notes to run today and then address some of your questions. So I'm skipping to the next one because we have a range of skills to look at and learn. Now we have got Edward, and his doctor has concluded that his curative treatment that included radiation and chemotherapy may no longer be effective and should focus on palliative care. Edward has been diagnosed with advanced melanoma stage 4. Now, typically, if somebody has a melanoma in an advanced stage, it could have probably been in metastasis, and so the cancer would have spread to other parts of the body, other organs perhaps. So you are having to talk to this patient and discuss those things. So the doctor has asked you, now this is again a nurse's role play, but whether you are a nurse or a doctor, you don't have to worry, or any other health professional, it's absolutely all right. It doesn't matter because the skills are the same. So a lot of candidates sometimes ask, like, will you be covering specific role play cards for specific professions? It's absolutely good to have specific role play cards for your practice, but looking at other role play cards will really enrich your experience and your learning curve gets better. So that's what I would like to say. So if you're not a nurse and you're looking at this role play card, it's absolutely fine, and you're going to improve your skills as well. So you don't have to worry about that. So this is a setting, you are in the oncology ward. And your background information says you have been asked to discuss a change in care plan for a terminally ill patient suffering from a rare form of melanoma. You've got 3 bullets here. Excuse me. Find out what the patient already knows about the condition and discuss the prognosis. Explain what palliative care is to the patient. Explore any concerns the patient has about his or her condition, right? Now, what did you ask to find out the patient about what they know already about the condition, and how do you start discussing the prognosis? This is going to be really hard even at the workplace, because you're going to tell somebody that their treatment is going to take a turn. And so this is almost breaking bad news to the patient, and it is not easy. Perhaps the doctor has asked the nurse because the doctor doesn't want to go through that situation, which is true. A lot of doctors find it difficult to discuss prognosis to patients when it's not really good. Yeah. So what all questions would you ask? Please type in. Warn the patient by saying you're about to discuss some news about the melanoma. Yep. Raju, yes. All right. Others, please let me know what you think would be ideal for discussing this aspect. Lucille says, hello, Edward. How are you feeling today? Then say that you're here to have a bit of chat regarding your condition. May I ask your understanding about your current condition, right? Hi, Aparna. Let me know your comment as well for this question. How are you getting on? Okay, Viji. Annette says, would like to know the extent of your knowledge. Can you explain in your own words? So that's Shibi John. Regarding the information you have about the condition you're experiencing, do you know what melanoma it is? How are you doing today? Shall we discuss about the condition? Please tell me how far you know about it, right? Yeah, so probably you could, so in a situation like this, now this is just an example, but it could be like either you're seeing this patient for the first time, let's say, but more often it should be a patient who is familiar to you. Seth says, may I ask you if you have any idea about your current medical condition? Okay, Victor, is it okay for me to ask you about it? Jamie says, but before that, may I ask you how you are informed about it? Diana says, if you don't mind, could you tell me about your disease condition? Diana, you are a specialist nurse, so probably you don't have to, go too basic, because the patient would certainly have an idea that, you know what he or she is going through, or in this case, Edward, yeah. How are you doing today? Can I know what you know about your condition, right? See, there would have been a couple of tests done prior to this discussion, and the doctor would have seen the patient. So it could also be that the patient is partly aware of what is coming, right? So you can expect that as well. And but either way, when you have something like this, there are a few things which you have to remember. Firstly, you have to be honest. There is no good in telling a patient that everything will be fine, you'll be fine. Don't tell patients like, there will be miracles and magic happening. No, 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 that's a big no no. So that is not a good thing for you to do. So at the same time, a lot of instances have been discussed when, let's say, a doctor tells the patient that this is what's going to happen. We are going to stop your radiation and chemotherapy. And the patient would be in for a big shock, perhaps the biggest shock of their lifetime, when somebody tells a patient that, their treatment is going to stop, it's not going to work, or perhaps they're going to die very soon. So you'll have to think of how you're going to discuss those things. So probing is the starting point of that. And it's very important because sometimes it makes things easier for you as a health professional. They might already have an idea. They might know that, for instance, Edward might know that he is in stage 4. Things are not so good. It's a bit bleak. And it's taking a bad turn. So ask about that. Something like, we've been treating you for a couple of months, and we have had a couple of tests recently to evaluate how the cancer is progressing. So I was wondering if you have any idea of what could be the current situation. Something like that, where you give a little bit of background and then ask the patient to explore with you. So that would be an ideal condition, but I mean a question, but you ask a lot of other things similar to that. That's all right. So, yeah, I can see some of your responses. Nigat Sultana says, would you mind sharing if you will explain regarding your disease status in your own words? Yeah, asking them to explain in their own words is a good idea. Right. Yeah, Caitlin, yes, said. Absolutely, yes. So you will have a general discussion and then you will provide specific information. So let's move on to the next, the next bullet, which is explain what palliative care is about to the patient. Now, again, a lot of people have a misconception, even in the healthcare industry, that palliative care is mostly about, preparing them for the end of life treatment programs, pain management, and all those things, which are all part of palliative care. But at the same time, when you explain palliative care, particularly to a terminally ill patient like Edward, you have to have a very holistic view. Your patient, let's say somebody in this stage, the prognosis might be he could live for, let's say, a few months up to a year perhaps, but it depends. Now, yes, Lucille, I see your answers, and Ankit as well. Yeah, till now you're under lots of chemo and radiation therapies, but and the bad thing is that it's progressing too much. So it's a good thing you should have to think about palliative care. Would you soften it a little bit, Angit, perhaps? It's too much of information for them to take in, perhaps. Okay. Archana says, Hope you know about your present condition and you're having an advanced type of melanoma. Sorry to tell you that I'm here to discuss about the prognosis. Okay. So again, it has to come a little bit more, softly, because you are giving the most shocking information of their life. So, yeah. So I was talking about palliative care in itself. Palliative care also includes their personal aspects, their imagine somebody has just a few months to live. They'll have a lot of aspirations, wishes to fulfill, people to meet, things to accomplish, and a lot of things. Their family, how their family is going to cope with this, and all of that is part of palliative care. It's not just about providing pain relief and preparing them into their last days of life, although different people will take it differently. So when you tell, for instance, let me think of what I would say. I might say like, well, the test results are in, and it's a little bit worrying fact that the cancer is slightly spreading to other parts of your body, and I suppose the chemotherapy and radiation will not work as much as we thought it would. So I want to discuss with you a care plan which would be ideal for you. And I'd like to bring to you something called palliative care. Not sure if you're aware of it, but this is what I feel is the best suited treatment plan for you at this stage of your condition's progression. So, would you like to discuss a little bit more about that? Would you like to know what it is and something of that sort, so that very slowly, with a lot of empathy, and you can even break it down into smaller chunks, and have the dialogue, checking back on them for their grasping of it. I'm just speeding up a little bit because we are almost running out of time. So think of things similar to what I've told when you're dealing with it. And finally, exploring any concern the patient has about. So they may ask you, like, how about medicines? Will I not be having any medications? A lot of things like that. So you'll have to, and also ask them to share with you any concerns they have, questions they have, but making it a very smooth transition. That's very important from your part. All right. So Deepa says, can we discuss about palliative care, which will help you for your well-being? Yeah. And Nihaya says, I'd like to discuss with you, if possible, with someone living with you about the future palliative care. Absolutely, yes. So it's all right. You can ask if a family member has to be involved in the discussions and all those things. In real clinical practice, yes. In the OET's context, depending on what's on your role play card, you can't contradict. So if you're asked to discuss with the patient, you'll have to do that. You can't, say that, okay, I'll discuss with a family member. That wouldn't be appropriate if that's not mentioned in the role play card. So you have to consider both the aspects. All right. So I hope you have learned a little bit on how to handle sensitive issues, embarrassing issues in the role play as well as at work. So just before we wrap up, I've got some more mini test where you can again perfect some of the skills which we have done. So some responses will be given, as you see on the screen. I do have the results here today. Would you like me to discuss it now? Now, for which situation would it be appropriate? Identify the suitable context for that. 1, 2, 3. Discussion on routine blood test, discussion on biopsy report, discussion on swallowing function. For which one would you choose this? Type in your response, please. Some of you got it right, some of you haven't, but it's all right. It's more suitable for the biopsy report. Of course, for a routine blood test you can ask, but having to have such a preface is more suited for a biopsy result. All right. So, for which context would this be suitable? As some of you had mentioned at the beginning, I'm embarrassed to ask you this. What can you tell me about your sex life? So is it for history collection in a general practice, or review of hormone test results, or discussion on causes of body odor? See, Raju, those are not watertight options. It depends on how you apply as well. But we are looking at the most suitable ones. More than history collection, it's more appropriate when you're reviewing hormone test results, because that's when you might discuss sexual issues more. And here's another one. You're very quiet. Can I ask what's going through your mind? So, is it suitable for counseling for a patient with depression, preparing a patient for colonoscopy, or talking to a patient recovering after a surgery? I think everyone is getting right with this. That seems to be a very easy option for all of you. Excellent. Yeah. See, you can use it when you're counseling someone with depression. So I suppose you have learned a little bit more on how to handle sensitive issues. Please let me know if you have any questions on what we have discussed. Sabina, again, yes, it depends on how you apply. These are not extremely tight rules. Let me know if you have any questions. I'd be happy to address some of your concerns about OET speaking. Let me know if you have any questions about the speaking subtest or anything which you how to introduce during sensitive topics. Okay, Alicia, well, it depends on how the consultation is going to be, but you can tell them, I'd like to discuss an issue which is perhaps a little bit embarrassing for you. Is that all right? Or something of that sort. Sabina, you have concerns in listening part C. Let me know what your concern is. I'm not sure if I'd be able to help you with listening right now. We're almost running out of time, but when you think of listening part C, remember it could be about the speaker's opinion, and sometimes you may have difficulty in understanding the language of opinion or attitude. So focus on improving those skills, Sabina. That's what I can tell right now. Because sometimes when someone is discussing some topic, they may not directly tell that. So you'll have to kind of understand what is implied. Kauta says how to talk to a reluctant patient. All right. Well, when you have a reluctant patient, you can explain why they should cooperate with you, what are the benefits, but certainly not force. In some cultures, perhaps health professionals can be a little bit more forceful and boisterous in their handling of a situation. So you can't tell patients, especially when you're thinking of practice in Western countries, you have to take this medicine now, it's important. No. So you tell them, like, these medicines are meant to help you with this problem. So would you consider taking them? I know you're worried about the side effects, but I would say the benefits are far greater than the side effects, and I'll be monitoring you for any of those side effects, and I will be able to help if at all you develop some of them. So this would be really helpful for you, and I want you to reconsider your decision not to take the medicines. So typically the interlocutor would agree to that. So it's about OET is testing your ability to handle difficult situations which you would actually encounter at the workplace. So remember, that's what's important. It's not about, you may not get extreme situations where the reluctant patient is constantly reluctant, never talking to you at all, and then you'll have to force. No, that's not the scenario. Or sometimes I've heard candidates discuss angry patients, and then the patient is in a tantrum. No, it is speaking, there wouldn't be too much of acting. So it's mild, variations of difficult situations, which you can handle with your ability, with your linguistic skills, with your language. So that's what's being tested. So you don't have to worry too much about the extreme scenarios which you may encounter. Ankit, yes, we'll be able to help you with, I'll be posting how you can contact us. Concern to reduce speaking task, hence 3 minutes for preparation. Obligatory, I don't really understand what you mean by that. Reduce speaking task. Are you asking? You'll have to ask OET to do that. But ideally, the OET's speaking task has been designed to help you or provide you with enough time to converse. So it's a good thing. When you're confident with your language skills, you should be really happy that you are able to speak and show how good you are. And so it's a time when you can show how confident you are. Of course, as health professionals, you are confident. So I want you to remember that at the OET's speaking test, a lot of candidates panic thinking, oh, this is a test. And they look at the interlocutor and perhaps start freaking out. You don't have to. When you look at the interlocutor, just think that this is your patient and you are the health professional. So you have the upper hand, if I may say so. You have this poor patient depending on you for comfort and consolation and care and treatment, and as we discussed today, how you can handle some of the embarrassing situations. So thank you very much for being part of this OET All Stars masterclass from IRS Group. IRS Group would be happy to give you a lot of training for your OET preparation. We have online packages, so you can download IRS Learning app from the Play Store, and you have some free practice sessions as well, or you can subscribe to some of the packages if you want some OET preparation. You can also contact us on the email ID or the telephone numbers given. They are Indian numbers, but you can even WhatsApp on these numbers, or you can visit our Facebook page and go to our website as well for more information. As one of the leading OET approved training providers, one of the few premium preparation providers in India, and the only OET All Stars provider from Asia. I'm happy to help you with your OET's test preparation, and please tune into the upcoming sessions, and I'm happy to help every one of you, and good luck with your studies, with your work. And so bye for now. I'll see you soon with another session. Thank you very much, everyone, for joining. Stay healthy, stay safe.